ये जीवन है, इस जीवन का यही है, यही है, यही है रंग रूप थोड़े गम है.
So, welcome to the program, Doctor, and it's always a pleasure to have you on the program.
Thank you very much, and it's my pleasure to be here. Thank you.
So, someone watching this, how would you describe vascular surgeon's job like? I mean, are they a body blood vessels mechanic, or how would you define that job?
Blood vessels, it's one of the very fascinating organ in the body, and the other way out is life is nothing but the blood vessels. Death and life, it all depends upon the blood vessels. So if the blood vessels are healthy, you're healthy.
So it's definitely a mix of a doctor, a surgeon, a plumber, and some superhero's job, I believe.
Yes, I think because vascular surgery is an emergency kind of a situation. Mostly we've been called in a crisis situation. So it's matter of life and limb. So yes, of course, it's definitely a very challenging branch.
So when we talk about emergencies, most of the time it's the heart, the brain, or any other organ. How does the blood vessels come into the picture?
I think that's a very pertaining question, and to answer this for a common population, I must say, we should go back to our darkest period in the life. That was COVID. Death, disability, and distress. This is another name of COVID. And the reason for having so much of significant mortality and morbidity during COVID, the reason was vascular inflammation. People who used to get COVID will have a lot of clotting of the blood vessel, and that is where we had such a dark phase in our life. So to make it understand, vascular emergencies, it's a question of life and limb, and if we are not acting in time, then probably it's going to be a definitely very, very big challenge for us in coming future also. So I would say when we discuss about the vascular emergencies, there are two things. Either it is bleeding too much, what we call in our language hemorrhage, or it is not bleeding at all. That means the blood vessel has got clotted. So that means in our language thrombosis. Both the situations, if it is bleeding more or if it is not bleeding, is an emergency.
And also talking about bleeding, I've read somewhere where the soldiers used to bleed a lot and during the wars or something. The surgeons used to treat the soldiers then and there. That was a very fascinating story. How did that happen?
Yes, our father of surgery, Ambrose Pere, he was the person long way back in 16th century. So he used to ligate the blood vessels. He brought the concept of ligation, and then the concept of vascular reconstruction came. Then Vietnam War. So Vietnam War was a kind of a significant kind of a progress in terms of vascular reconstruction for trauma patients. They started reconstructing the vessel, and then that is how the results started coming up. And now, of course, with the technology and the skill, and after going detail into the concept, we tend to reconstruct all these blood vessels and can save many of the limb and life.
That's some incredible skills, I suppose, the surgeons had on the battlefield to save the soldiers. So you mentioned that, vascular surgery or these emergencies are raced against the time. So how important or how crucial is that period, especially in trauma?
We oftenly, whenever we are in emergency, when discuss about this golden period, and more so golden period of 6 hours. So we keep on discussing among ourselves, our colleagues, and keep on telling patients, relatives also, that you have come in a golden period, you have not come in a... More oftenly we say you have not come in golden period, because the referral system is like that. Vascular emergencies, trauma gets neglected or maybe ignored also to some extent. So people will come little late.
So most of the time, I think it's a broken bones or some other organ getting...
Yes. Golden period of 6 hours, there is a science behind it. Once there is a disruption of the blood vessel, if the blood vessel is blocked, suppose, then the blood supply will cut off. Once the blood supply cut off, then there are organs like skin, muscles, nerves. They will not get enough amount of oxygen which is required for the metabolism. Once the muscles go into irreversible phase, then it is difficult, because even if you do good bypass and reconstruct the blood vessel, if the muscles are not working properly, then we will not be doing any justice to the limb.
So every minute is important and time is to show, I believe.
Of course, yes. That holds for each and every specialty, I believe. Yes, of course, vascular surgery, because, oxygen is the most important thing. Blood carries the oxygen. So definitely, yes, blood vessels, they're very sensitive and very delicate organ. And that is how we have to be very, very careful, and we should quickly identify. The beauty of this particular, thing is that we can identify a person having a vascular injury only with history and physical examination.
It sounds so basic and simple, isn't it, in preventing such major trauma or major injury happening to the body by just examining the patient the right way.
Yes, of course. I mean, I would stress to the public also, because vascular emergencies, especially the trauma, our young populations gets involved into it. The more productive, sometimes it's the only breadwinner for the family.
Yeah.
The beauty of this particular, kind of a reconstruction is because their blood vessels are healthy blood vessels. They are not having any atherosclerosis. They are not having cholesterol. They are not having diabetes. So once we repair these blood vessels, lifelong, they will have a healthy blood vessel, and probably they will not come back with any consequences later.
So now let's step into the OR. How does it feel when you are operating on some major emergency, like say a bleeding artery? How does it feel?
It's always a challenge. Each and every case is a new case. More than that, there's a lot of pressure also. There's a lot of pressure from the family.
Yeah.
As I mentioned, most of the time it is the young population, productive people. And when there is a vascular injury, we will have simultaneously other injuries as well. Also, we have orthopedic injuries, we have kind of soft tissue injuries. So it's always been a challenge. If the patient comes with bleeding, then it becomes very difficult, challenging. We have to shift the patient immediately to the operation theater. If there is a major blood vessel which is disrupted, like aorta, then I think we are fortunate to be in this era when we have endovascular procedures available. We have balloon. We can put the balloon, stop the bleeding, and then can go inside and repair it.
What was the most dramatic emergency situation you've handled?
I got a kid of 12 months with a vascular injury. So it was, yes, very difficult. The artery was like a hair, and I have to repair it with putting a vein graft. So it was very challenging, but it was very satisfying, as I could able to restart the blood vessel, the blood flow, and then child become all right.
So how do you handle such stressful events in your day-to-day life? I mean, do you say fast and furious?
Definitely, when we see a patient coming in a situation like this, and the patient going back after the discharge with a smile, that makes a lot of difference. And now we understand. We understand the importance of managing these patients. After 45, you have done good work. You will be on the top of the world. You have to maintain now. So the stress starts now. The stress starts after 45, and burnout, a phase of burnout. We don't discuss all these things, but stress and burnout, the two things which is very, very common among surgeons. So it starts after 45 years. So 45 into 55, I think we should also rediscover our passions.
I like that word, rediscover the...
We should be. I mean, because when I was during this phase, COVID came.
Yeah.
So I rediscovered my passion, all the passions. I started music, singing, playing, and writing, and so many things.
So you definitely have the right balance of everything. So what are some secret habits which you think would be hitting our pipelines daily?
Most important is smoking.
Number one, you say.
Number one is smoking. For any vascular disease, smoking is poison. Because we cut open the artery, we see what is there inside. It's all charred out. Second is, of course, nowadays, obesity. Diabetes, the risk factors. Diabetes is something which is number one cause for an amputation every 20 seconds, one person is losing leg. Every 20 seconds. By the time we finish our discussion, I think 50 limbs will be amputated. These are the high-risk group. We have to identify these patients.
If arteries could talk, what do you think they would be telling us?
Touch me not.
That's a good one. So before we wrap this episode, Doctor, is there any message that you would like to share with our viewers out there as far as vascular health is concerned?
Every minute there is an accident. Every 5 minutes there is a death. More people dies of road traffic accident due to vascular injuries rather than diseases in the India. So best way to change these statistics is we should be able to pick them up early. We should diagnose them early. We should bring them to a proper center where there is an expertise to treat these patients. Diagnosis is very important and the treatment as well. So decisions are important than incisions. This is what I feel. If your decision is good, patient will come out. But if your decisions are not good and if you are doing a surgery, probably the results are not. So decisions are very important than incisions. For this, what is required is a multi-specialty organization where we have multidisciplinary approach. We have to have people with us. It is not me alone who can do. We have to have other specialties, like we should have orthopedic good team, we should have plastic surgery, neurosurgery, and above all, we should have hospital to gear up for these emergency. We should have a good intensive care, and at the same time, we should have a diagnostic facilities which can sustain these kind of a load, and as well as we can give us a good diagnosis. So vascular emergencies are challenging, but it is associated with a lot of morbidity and mortality. Can be avoided. It can be avoided provided if we are proactive, we can diagnose early and probably treat them in a nice way.
So thank you, sir, for such an inspiring and such an informative session. It was wonderful interacting with you, and thank you so much for coming.
Thank you. Thank you for having me. Thank you very much.